Good morning, good evening, everyone, wherever you are. My name is Dr. Henry Njuguna. I'm an epidemiologist with the Coalition for Global Hepatitis Elimination here at the Task Force for Global Health. I'm going to talk to you about building a coalition, a community of practice for the introduction and scale up of hepatitis B virus vaccine in Africa. I'm going to talk about the importance of the vaccine, the community of practice that we are building, and the next steps that we are working towards making sure that we have a future of African children free of hepatitis B virus infection. The hepatitis B virus burden, chronic hepatitis B virus burden is very high globally with 296 million. Africa has 82 million, meaning that we have 1 in 4 persons who are chronically infected globally in Africa. The incidence is also very high, with 1.5 million cases reported annually. And Africa has 990,000. That is 2 in 3 of the new chronic infections globally. Children in Africa are at risk of developing chronic hepatitis B virus infection with a 90% chance. And children infected at birth have the highest risk of hepatitis B virus infection related liver cancer. Rates of horizontal transmission are decreasing with the scale up of hepatitis B vaccine given during infancy. And because of safe injection practices, horizontal transmissions are also decreasing. This makes the mother-to-child transmission of hepatitis B become more prominent with a decrease in horizontal transmission. Unfortunately, less than 10% of African children receive the birth dose vaccine, which is the lowest coverage in the world. Hepatitis B through modeling studies has shown that it can avert quite a number of deaths. Looking at other vaccines in this comparison is actually second to measles. And it is estimated that between the year 2000 and 2019, about 22 million deaths were prevented by hepatitis B vaccine, birth dose vaccine. And then it has a potential of preventing a further 38 million deaths. That's the importance of hepatitis B vaccine. In Africa, we have only 14 countries that have introduced the hepatitis B birth dose. And in those countries, as shown in the graph with the red line, the coverage is quite low. And in 2020, we have it estimated at 6%. We brought together with USCDC are building a community of practice to support the introduction of hepatitis B birth dose in Africa. We convened stakeholders meetings where they shared their experiences, and also we shared some toolkits that we have developed to help the NITAGs, then that is a National Immunization Technical Advisory Groups, with the recommendation process. We had various stakeholders participate in these meetings as shown in the figure, and we had 35 countries represented by participants in this meeting. The first meeting focused on partners. The second meeting focused on Ministry of Health officials. The third meetings, we had NITAGs presenting their experiences. And the fourth meetings, we had maternal child health, as well as civil society organizations presenting. In terms of country experiences, we learned that coverage in some countries is low, like in Nigeria, because of poor vaccine access, because the vaccine at times is not available in some facilities after working hours. The issue of home deliveries, and therefore not able to access the children when they are born. There's also lack of knowledge among healthcare workers about the importance of timely hepatitis B birth dose, and also poor record keeping. Countries that had birth dose reported some of the barriers towards implementation of birth dose. This included lack of local data to convince policy makers about the importance of introducing the birth dose. There's also lack of funding to implement hepatitis B birth dose, the low institutional deliveries, and also the challenge of task shifting, assigning new roles, especially to MCH staff to give the vaccine. There's also need for cold chain infrastructure. In terms of strategies to improve hepatitis B birth dose coverage, the discussions were that you can enhance maternal child and EPI collaborations. You need to also improve vaccine access in delivery rooms, training healthcare workers about the importance of hepatitis B birth dose, and also pregnant women so that they can be able to demand for it and also seek hospital delivery to get the vaccine. There's also need to engage the community to be able to reach those children who are born out of health facilities. And there's need to revise data tools to capture timeliness of birth dose. NITAGs also reported their challenges. For example, they lack local data to support the evidence. There's also difficulty in accessing some published literature. Some of them are in languages, especially for the French speaking, that they cannot be able to get French written literature. There's also technical challenges with reviewing, evaluating, grading evidence. There is a lack of sufficient support personnel to support the gathering and report compilation. And there's also lack of hepatitis B birth dose implementation, despite making recommendations like was pointed by Zimbabwe. There is also resources being strained, especially because of the current COVID-19 pandemic. We have presented a toolkit for hepatitis B birth dose recommendation, and in this toolkit, we adapted the framework for recommendation, evidence recommendation framework towards hepatitis B birth dose vaccine. We also are compiling together some of the evidence and putting them in one document, in one toolkit that countries can use, especially the NITAGs, to making this particular recommendation. In terms of next steps, we want to assist NITAGs with the process of making a recommendation. We want to complete the toolkit, have it translated to other languages like French and Portuguese so that those countries can benefit from it. We also plan to disseminate all these toolkits to NITAGs so that they can be able to access them. We also want to expand the community of practice, engage civil societies, maternal child health, who are actually the best place to vaccinate in a timely manner, and also promote peer-to-peer collaboration through sharing databases and maybe set up an eco model to be able to reach professionals who are involved in all this, to be able to learn from them. For more information, you can get this information from the website listed, or you can reach me in the email provided. Thank you very much.